We're going to start the chemical hazards, which is very important also in other. So let's start it. Bismillahirrahmanirrahim. So basically, when dentists are exposed to chemicals, so it includes mercury, methyl acrylate, silica, beryllium, formaldehyde, and latex during different procedures. So it can cause action in three ways: either local, inhalation, or ingestion. Number one, we will study about the mercury. Mercury is actually an element of mystery. Actually, it is a metallic silvery liquid. The average dose on a daily basis should be 1.2 to 1.3 in micrograms. It can cause poisoning in the form of okay, it's not used, but in some clinics still the amalgam filling is used in which the mercury is present. So some dentists actually use this amalgam in which we have actually mercury. The what it can cause when you have mercury: poisoning. It can weak your muscles. It can cause metallic taste in your mouth. It can cause nausea, vomiting, lack of motor skills, or feeling uncoordinated, inability to feel in the hands, face, or other areas. Change in vision, hearing, or speech means there is a change in your speech while talking, even during looking. Actually, difficulty in breathing also. How to prevent encapsulated alloy? Good ventilation. Spilled and excessive mercury should be collected in fixer containing break resistant bottles. You can see which I have told you the amalgam actually. So the arrows are pointed towards the cracks in the silver filling and tooth. Yes, you can see it. Okay, basically now methyl acrylate actually, which is used in your dentures actually. It is a monomer used for your denture repairing and making. How it can affect: it can cause irritation to the eye, skin, and oral mucosa. Actually, it can cause allergic dermatitis, asthma, paresthesia in your fingers. Actually, headache, nausea, fatigue, sleep disturbance, loss of memory, and allergies. For allergies, Neutralia forage gloves are used. You should use these gloves. Silica is also while making the crowns, inlay, and onlays. Inhalation of dust containing free silica or silicon dioxide in your ceramic labs that can lead to silicosis. It depends upon the size of dust and duration, for how much time and how frequently you are exposed to that procedure in which the silica is present, the composition of dust, and individual susceptibility. Higher the concentration of dust, the greater is the hazard actually. Okay, beryllium, it is added to some base metal alloys which is used in crowns, bridges, and partial denture frameworks. Yes, it is a corrosion resistant and rigid and light weighted metallic element. If inhaled dust contains beryllium, it can while on working on dental crowns and bridges and partial dentures like chronic beryllium disease can also cause exposure to these. Exposure should not cross more than 2 micrograms or cubic meter of air for 8 hours time weighted average. How to prevent: actually improve the engineering, control, and work practice. Formaldehyde is also, it can be used for disinfection purposes. It can cause acute eye and respiratory irritation, abdominal pain, nausea, vomiting, and possible loss of consciousness can occur. Chronic, it can cause laryngitis or bronchitis. Xylene, which is used for sterilization purposes in clinics. It can effects are dizziness, headache, mental confusion from inhalation, eye, mucosa, membrane irritation. In chronic, it can cause actually by methylation of the toluene and benzene. It can cause actually the chronic actually. So now moving towards the commercial or laboratory grade xylene produced usually contain about 40 to 65% of M-xylene, up to 20% of each of O-xylene or P-xylene or ethyl benzene actually. So these when xylene has benzene as an impurity, it can be repeated breathing of vapors over a long period. The patient can cause actually leukemia, which is actually the cancer of the blood. So it can cause also cancer actually, very important. Latex gloves. Okay, latex gloves with corn starch powder are most often used. So the barrier against most pathogens, and they can also constitute a good barrier against viruses provided by their intact, but most people are allergic to this. So it can cause urticaria, you should use actually non-latex gloves or vinyl or nitrile forage gloves. You should use actually